So I've done a case study for my thesis at KIT on a Master International Health. I chose to look at infertility from a public health perspective in the country of South Africa as a case study. The presentation will look into a bit the structure of the thesis itself with the introduction, background, objectives, the methodology, results, and of course, conclusions and recommendations. And I'm also very much interested in hearing your comments at the end and questions. And hopefully that can lead to a fruitful discussion. I'm trying to keep my speed all right for the interpreter. So if somewhere in the way I'm going very fast, please let me know. I think I've started with some general figures as a background. As I think most of us all know, infertility is a very common problem. And about 186 million married women of a reproductive age suffer from infertility worldwide. And the numbers are a bit, they're not all saying the same things, but all of them do indicate that that's very common. So 121 million couples. And if we then zoom into more the African continent, there is a research done that shows that 60% of all the countries in that specific survey reported that they have infertility rates of over 25%. And even 30% of the countries that the infertility rate is over 30%. Of causes of infertility, of course, they are based on female factors, male factors, and combined factors. And in sub-Saharan Africa, in general, most of the causes are related to reproductive tract infections. And that is much higher than it is globally, where that figure is 33%. For South Africa, I wanted to give you a bit of a background on the health system, since that's a very important factor to look at this thesis. Basic primary healthcare is offered for free in the public healthcare system. And it serves about 84% of the entire population. Only a small majority of 15% actually has health insurance. And the government has launched a national health insurance plan in 2019, which is not yet implemented, but which aims at covering healthcare costs and having everyone in a national insurance plan. As many countries, of course, South Africa also faces some health system challenges, which of course have to do with the complex burden of diseases, which combine infectious diseases, non-communicable diseases, accidents, and now, of course, the COVID-19 pandemic, which I think we've all heard about. Other important issues are quality concern issues and ineffective and overburdened healthcare system, and inefficiencies in healthcare delivery, and of course, very high costs. The objectives of this thesis specifically was in general is to contribute to improving preventative and supportive measures for people dealing with infertility in South Africa. So where you see the abbreviation RSA, that means Republic of South Africa. And more specifically, to explore the magnitude of the infertility problem, to describe the social determinants, to identify and analyze the consequences of infertility for individuals, and to identify effective approaches to infertility in South Africa and beyond, which could be implemented or scaled up in South Africa. And of course, to formulate some recommendations. What I've done is a comprehensive literature research. This is a desk study, which I did through databases such as PubMed, Medline, Google Scholar. And I looked at articles which have been published from between 2000 and 2021. And I've used a conceptual framework, which I will show you here. So this conceptual framework was used to analyze all factors surrounding infertility. And as you see, I hope you can see my pointer. It is divided in different columns. And I have looked at all of the different factors that are shown here. Because of time, I will not discuss all of them, but I will focus on the most important ones. And just to give you an interpretation of the framework, you see here the socioeconomic and political context of the country in South Africa. You look at socioeconomic position, which is very important, and so with factors such as social class, gender, ethnicity, education, income. And those, of course, also again affect other determinants of health, such as material circumstances of people, their living and working conditions, their own behaviors, and the biological factors, but also psychological factors. Another very important part of it is the health system itself. And all of these factors, they influence each other, which is indicated by the arrows. And also they impact on health. But there is a feedback loop that also then again has influence, for example, on people's socioeconomic position and on the bigger context. So we'll focus on causes of infertility, but also consequences. To look at initially the magnitude of infertility, that is something that is a bit difficult to really find out. The exact magnitude on its own was never studied in South Africa. And there is circumstantial evidence from different small-scale studies that it is a big problem. And the government and most papers, they use an estimate which is mentioned to be 15 to 20%. However, there's not a very clear reference to the source. This number is mentioned in the article of Cooper. And then if you try to link to the original data, it's very difficult to find. So this number is constantly used, but it's not very clear on how it has come about. However, the magnitude is likely to be underestimated because circumstantial evidence has mentioned that the problem is very common. And for example, the Demographic Health Survey from 2016 has an entire chapter on fertility, but actually not one question on infertility. And the male factor infertility in South Africa was actually never studied. But letters and editorials in local medical journals have mentioned also very high numbers between 15 and 20%. Then to move on to more the structural determinants for infertility in South Africa. If you look at social policies, there's free healthcare in the public healthcare system. There's free basic education, there's free housing and free basic services. And the government is working towards the implementation of the National Health Insurance Scheme. And there are occupational and health safety acts that require employers to keep the workplace safe and protect staff to exposures and toxins that could lead to infertility. And actually, most importantly, the government has come up with a very progressive guideline, which is the National Integrated Sexual and Reproductive Health Rights Policy, which was published in 2019. And in that, all relevant sexual reproductive health issues are mentioned, including fertility, and also all SRHR issues that are related to infertility, such as sexual STIs, adolescent pregnancies, HIV, the health system, and the lack of data and monitoring in broad terms. And it mentions infertility as one of the emerging issues that we should be focusing on in the SRHR landscape, with the focus on increasing access to management for people facing infertility and counseling. It does mention that these infertility managements and treatments are provided in the tertiary level of the healthcare system, and the policy also seeks multi-sector engagement between governments, civil society, private sector, and development partners. Then the Ministry of Health also came up with the national guidelines of safe conception and infertility, and these are more specific treatment guidelines. Okay, I thought maybe someone was asking something. I'll continue. They have a couple of very important topics. They focus on prevention, safe conception, and ways to preserve infertility for individuals, including lifestyle factors, prevention of STIs, HIV, and increasing health education. They clearly detail what should be the diagnosis and evaluation and workup plan, including proper standards of care and the diagnostic workup, and very important, emotional support as a basis of standard care for people facing infertility. Since this is very important. And they also have specific mentioning of LGBTQI community and people living with HIV. And these are all in line with the international guidelines and human rights-based perspective as well. Then to move more forward, in the first column, the framework, you have the cultural and societal values. And as in South Africa, as in many different countries, children are valued to be very important. South Africa is a very diverse country when it comes to ethnicity, religions, cultures, and beliefs. And yes, what they say, successful procreation is celebrated as on a social cultural level as well on a personal level. And marriage is considered a communal affair, and therefore children are usually expected shortly after the marriage. And especially where bride price is paid, which is called lobola in South Africa, there is even more pressure on women by family members from both sides for women to conceive shortly after the marriage has happened. And there is research that shows that when they don't conceive soon, polygamy strategies are adopted. So people search within other sexual relationships to do actually conceive. And in some cases, adolescent pregnancies also occur, where young people have to prove their fertility at an early age before they can actually get married. And also the blame for the childlessness is actually mostly on the women, although we know that men have also, it can also be cause of a male factor, of course. And also in South Africa, religion is an important factor, and children are seen as a gift from God. And if there are no children, it could be a punishment for wrongdoing. And it's important to realize how strong these values are embedded in the society. And they also lead into what it means for individuals to not be able to conceive. Then moving more towards the social determinants of infertility, I want to share something about the socio-economic position. Infertility itself can occur in all layers of society, and there is some data from Dyer, a gynecologist in Cape Town, where there is circumstantial evidence that women with infertility at their clinic had lower levels of education and unemployment. And the hypothesis is that this is due to higher risk behavior. Because they have, the idea is they lack empowerment to negotiate safe sex, They lack reproductive health knowledge. This could lead for them to be at higher risk of infertility due to STIs, etc. Then infertility also has many consequences on one's socioeconomic position, because many people are secretive about it due to high levels of stigma. And men respond that they face very many negative experiences from their communities, lack of respect, they're not seen as a real man, and they face lots of bullying. And women report that they also face face stigma, ridicule from not only their family, but also their society, and that they feel very excluded from the society, and that they suffer with pain and sadness and anger, and therefore they isolate themselves. When it comes to income and economic status, the access to infertility services are determined by one's financial means. Since most of the care is given in tertiary level, and people have to do out-of-pocket payments. So infertility, as a consequence of infertility, people make out-of-pocket expenditures, they invest in travel costs, they miss work, and they actually make catastrophic expenditures. And for couples to cope with this situation, they borrow money, they sell property, they reduce spending even on basics such as food and clothing. And these are people that are actually already accessing these services. So, well, most can't even access the services. And recovery from these expenditures 5 years after the treatment was very, very low. Another factor to look at is gender. So women, they see infertility as a very big threat to their relationship. They are worried about the consequences. They're worried about divorce. They face abusement and face infidelity from their partners. And men, they see it a bit different, in the sense that it also has negative impact on their relationship, and that they are faced with stigma, although they don't speak about it so openly. And they acknowledge that women suffer actually much more than men. And that's from stigma, but also violence against them. Then if you move to the third column, you look at intermediary determinants. And you can look at behavioral and biological factors. So one of the things that is associated with infertility is body weight, and that's obesity and being underweight. They can both influence one's fertility. And obesity is most common in women, 40%, and 10% in men, and underweight is not that common. It's only in young adults and children for 3% of them. Another important factor which influences your infertility is alcohol and tobacco use. And tobacco use is 8% in women and 37% in men. And alcohol on a problematic level is in 16% of men and 3% of women. And also, once people face infertility, they also, as a way of coping, use alcohol. And therefore you already have infertility, you start using more alcohol, and your infertility chances even reduce. So this is also an important factor. And then most important in South Africa, I think, is sexually transmitted infections, HIV, and sexual behavior. That is also a topic in the third column of the framework. Their STIs are in about 20% of the population prevalence, and it's seen as the most common cause of female factor infertility in South Africa. Another very important one is, of course, HIV. South Africa faces one of the largest pandemic in the world with a prevalence of 20.4%. And HIV is a complex, there's a complex interaction with HIV and fertility. First of all, if you look, when people want to conceive desperately, it can lead to more bed partners and exposure to HIV and STI, which then also reduce the chances of conceiving afterwards. And the HIV infection in itself is also associated with infertility. So 15 to 20% of HIV positive people suffer from infertility in South Africa. And others mentioned even numbers of 66% of HIV positive couples that are facing infertility. So these are extremely high numbers of people. And we should not forget to pay proper attention to this group. Psychological factors are very important as well, especially the consequences of infertility. But even before that, there is more and more evidence coming about that stress has a negative effect on reproductive outcomes in general. And that is in conceiving spontaneously, but also on the treatment outcomes of infertility. So also for couples that are in the treatment program, stress should be reduced. And then on the other hand, as I've mentioned before, the fear of infertility can lead to risk behavior, which leads to maybe STIs and HIV. And the infertility itself also affects people's mental health. So another study by Dyer in a clinic in Cape Town showed that men and women have very high scores that indicate acute psychological problems, and that they are significantly higher than people attending the ANC clinic. And also in this data, it is showed that that women suffer more than men. Emotions that are reported by men are sadness, pain, emptiness, isolation, and feelings of guilt towards their partner and their family. And all the women in the study, they expressed very intense emotions as pain, anger, depression, bitterness, guilt, also again, loneliness, self-doubt, failure, and frustration, with 2 of the respondents out of 30 to have mentioned that they had suicidal thoughts as a result of infertility. And that they said, the majority of women said, without children, we don't have a purpose in life. So the impact of infertility is very big when it comes to psychological factors. Then more about the health system. So all ART services require out-of-pocket payment. ART means assisted reproductive treatment, a bit confusing from ART on HIVs, but so these are, for example, IVF, IUI, ICSI. So these are the treatments that are used to treat infertility. And they all require out-of-pocket payments. Some are state subsidized, but this is only in 3 university hospitals in the entire country. And they are still unaffordable for the majority of the population. There are many private clinics in the country, most of them are actually, and only a few of those private clinics offer low-cost IVF options. And these private clinics, they offer world-class services. And this is also where most of the staff works. So there's a lack of trained staff in the public sector for infertility. And all these facilities are mostly located in big urban areas. So, and it's very unequally distributed around the country, and there are very long waiting lists for people to access the services. I've heard from ranging to 1.5 years for you to be able to access them. And there are also reports of long delays for being transformed from the primary level all the way to the treatment level. And this is due to numerous reasons, which is lack of staff, lack of knowledge, and lack of resources. And many of the people also visit traditional healers. And the role of the traditional healer is mentioned, but not really into the sense that there's data showing what the traditional healers actually do. So like I've said, there are the context of which infertility sits in the country of South Africa. You have the private health sector fertility clinics. There are health insurance companies that some cover diagnostic workup, but not treatment, except for one of the largest one that now started offer treatment, but under very strict conditions. There is the most important NGO that lobbies for patients is IFASA, and they also engage into legal battles with insurance companies and to get more coverage, and they try to lobby with the government to improve services for people dealing with infertility. SASREG, which is the body for gynecologists and people working on infertility, they provide guidelines and they represent the healthcare workers in the country. ANARA, which is the African platform that registrates for registration of IVF and dissemination of information. Then there are universities, there are many research groups, and then a group that I think personally that is not very active or under-mentioned are traditional and religious leaders, public figures, and international donors and NGOs. They are, for what I can find out, are not very active in the debates of infertility in South Africa. So to conclude, infertility is a big problem in South Africa, although we don't know the exact magnitudes. The framework that I used to assess all factors of infertility in South Africa, turned out to be very useful to look at it from all angles. The South African health system does not cater very well for people with infertility. There are many barriers for individuals facing infertility to access these services. Infertility is a problem that has many negative consequences, ranging from one's socioeconomic position and how they are in society. And if people facing infertility face very high, big amounts of stigma, issues in their relationship, gender-based violence, and their mental health also suffers a lot, and of course also their economic status. The government in South Africa, I think, has done an outstanding job in creating the SRHR policy and the treatment guidelines. So far as I know, no other country in Africa has these guidelines, which I think is very, good, and especially because they're also based on a human right-based approach. And I think you can also, what I concluded is that the causes of infertility in South Africa are very multifactorial, and they do need a public health-based approach that focuses on integration of infertility in other services and SRHR. So to summarize a few of my recommendations, there are many more in the thesis, but for time I'll just focus on a few. I think there is need for better data and monitoring and more research to really know which factors are most important and how big is this problem actually. I think there should be a focus on the implementation of the policy and the guideline, with a special focus on marginalized groups, such as the people living with HIV. The service delivery when it comes to infertility should be strengthened, and the government should acknowledge the marginalized position of women and men dealing with infertility and make this more publicly known. And in the end, I think that the government should also move towards covering treatment for people with infertility within the National Health Insurance Plan that's coming up. And then there should be discussions about which treatments should be covered or how this can be more accessible for people. And another very important thing is that there should be efforts made to reduce stigma and increase awareness about this very big problem of infertility in South Africa. Yeah, so this is how I wanted to end. I hope you've enjoyed the presentation, and I'm very much looking forward to your questions and the discussion.